Hello, everyone. Welcome back to FunDERMentals with Dr. Adobe Obasi. I'm a physician scientist board certified in dermatology and dermatopathology. In this video, I'm going to be discussing 3 skin biopsy techniques that are commonly used by dermatologists. Skin biopsies are techniques used to take samples of skin specimens. They could be skin growths or skin rashes, either in part or in whole, and then send that specimen or specimens in a preservative called formalin to a laboratory that can then process it and stain it and present it for analysis by a specialist. The specialists that diagnose biopsy specimens from any part of the body are called pathologists. Specifically, those that diagnose skin biopsy specimens are called dermatopathologists. The dermatopathologist looks under a microscope to be able to identify different patterns to help with the diagnosis of different skin conditions. And then in a report, they inform the dermatologist or the clinician that sent in the specimen of what they saw and their diagnosis based on the skin specimen. This can be very critical to assist dermatologists and other healthcare providers in helping their patients through getting specific diagnosis of what skin growths or skin rashes may be going on with the patient. Comment below if you've ever had a biopsy done of any type by a dermatologist or by your primary care doctor. The most common local anesthetic used in dermatology for skin biopsy purposes is called lidocaine. It's usually combined with a chemical called epinephrine to enable it last longer so that the patient is more comfortable for a period of time. However, injecting of the lidocaine with epinephrine or lidocaine alone for different purposes can be very uncomfortable. It's usually described as the worst part of the biopsy experience. It is described as feeling like a pinch and a burning sensation, which can be very intense. So now I'll go ahead and describe what a shave biopsy is, as well as the other biopsy techniques. The shave biopsy involves, after cleaning, marking, numbing the skin, a blade used to remove the growth in a plane just underneath the growth. It doesn't require stitches. The specimen is now sent for processing and analysis, and it's usually followed by stopping the bleeding, which is called hemostasis. Hemostasis can be achieved by using a solution or a hemostatic agent, such as aluminum chloride, or using a hyfricator to singe off the bleeding blood vessels. The shave biopsy technique is usually used in growths that stick up from the skin. Here's a video of me performing a shave biopsy on a patient. The next technique is a punch biopsy, which utilizes a specialized instrument that the edge looks like a cookie cutter to punch into the skin after it's been cleaned and numbed to extract a plug of skin. This is excellent for scalp biopsies, to look at the hair follicle and to assess rashes, pigmented or brown spots on the skin, as well as different skin growths. The punch biopsy is usually reserved for growths that extend past the top layer of skin called the epidermis into the dermis, so that a more complete picture is gotten when the pathologist or dermatopathologist looks at the specimen. The punch biopsy usually requires stitches, and the clinician determines what type of stitch they want to use, whether it dissolves or doesn't, and when they want to remove the non-dissolvable stitches, depending on the body site that is being biopsied. Here's a video of me performing a punch biopsy on the patient. The last technique I want to discuss today is the excisional biopsy, or the skin excision. This is usually reserved for larger lesions or when the goal is to completely remove a skin lesion or a skin growth. This technique can also be a treatment for skin cancers and other growths where complete removal is desired by the clinician and the patient. So after cleaning and marking the area, local anesthesia is now injected around the growth, called a field block, and sometimes, depending on the type of growth, within the growth. Then the biopsy is performed by an elliptical cut on the skin, or an ellipse on the skin, which looks like a football shape, enabling for a closure into a line versus resulting in puckered ends, what are called dog ears. The elliptical shape is important because it enables for round growths to be closed into a line scar. If an attempt is made to close a circle into a line scar, it results in puckered ends, which mimic the shape of dog ears, or certain breeds of dogs, I should say. So it's commonly called dog ears and is undesirable because when it heals, it results in two bumps or two pouches of skin, which patients don't find desirable. So the skin surgeon, attempts to remove those up front. And that requires a slightly larger scar from what the growth was, usually on average 2 to 3 times the diameter of the growth, and enables for the wound edges to be closed into a nice line scar, which heals much nicer for the patient. Excisions usually require stitches. Usually there are deep stitches that dissolve over many months, as well as top stitches on the top surface of the skin that need to be removed depending on the site that is being excised. For the head and neck area, usually it takes about 10 to 12 days. Sometimes 7 days, depending on the location. And for places like the back, it may take between 2 to 2.5, 3 weeks, depending on the size and the location. Here's a video of me excising the cysts from the skin. Comment below if you've ever had any of these procedures done or have had lidocaine injected for other purposes, and describe how it felt. Thank you very much for watching this video. If you haven't already, please subscribe to this channel and click on the notification bell so you can know when I post new videos on dermatology and skin-related matters. Feel free to check out some of my previous videos, from sunspots to hair loss to genital bumps to how to take care of your skin. I hope you have a wonderful day, and God bless.